Meherazade Sumariwalla is currently the Director of Customer Success at SeamlessMD. She joined the team in 2018 after consulting for over 5 years in the healthcare industry. She was previously at KPMG Advisory Services in Mumbai, India, and the Advisory Board Company in Washington, D.C. Meherazade has a BA specializing in biology and economics from Wesleyan University and a Master's of Health Administration from Johns Hopkins Bloomberg School of Public Health. Meherazade has worked with numerous hospitals ranging from large academic medical centers to community hospitals to improve quality, reduce costs, and tackle care variation, with an emphasis on using data-driven insights. Her experience spans the areas of length of stay and readmission reductions, decreasing unnecessary imaging utilization, antibiotic stewardship, and projects spanning surgical and medical divisions. In her role as the Director of Customer Success at SeamlessMD, she most enjoys when customers see the value of engaging their patient populations and achieve tangible improvements in outcomes and as a result. Meherazade, welcome to the show.
Thanks for having me.
Hey, Meherazade, just to kick things off, can you just confirm for everyone that you volunteered to join us today and you were not at all coerced into anything that you say on the podcast today?
Yeah, Josh did not threaten that he would fire me if I didn't come on the show. So yeah, we're all good.
All right, thank you.
So you guys have a bunch of questions for me?
We do. We have a few prepared questions, but this is your show, Meherazade. Today, we wanted to highlight another resident expert. In this case, for someone with customer success background and another consulting background. So we thought, highlighting Meherazade and what the customer success team and implementation team is like at SeamlessMD would be beneficial to all of the millions of viewers that we have out there. I think where I wanted to start, Meherazade, from your background, it seems like you were always interested in healthcare, even from an early age. How did that start? Where did your interest begin in healthcare, and was that always the trajectory for your career and where you wanted to go? Or
yeah, so the short answer is yes, with the exception of maybe the 2 years where I wanted to be an astronaut and an ice skater as a child. But every other career always involved healthcare, and I think it kind of stems back to growing up in India. I grew up in Mumbai, which for people who don't know is a city of about 18 million people. And the one thing that's very obvious as you walk down the street are the stark disparities between the people who live there. And we're talking about everything from poverty and education to a lot of healthcare related things like access to clean water, hygiene, homelessness, access to medications. And so from a young age, I was always very aware of this and always thought I wanted to do something that would have a positive impact on a large swath of people. And so while, doctors work one-on-one with patients and do amazing things, I always kind of wanted to do something that I felt would be beyond that, whether it was administration or policy or research or something that potentially impacted a larger number of people than I could ever sort of personally interact with one-on-one.
I want to ask you, Meherazade, so, obviously you were thinking about maybe even like hospital or healthcare administration, but eventually you decided to go into consulting, I think initially at the advisory board company. What made you decide to do that instead of maybe going into the hospital administration setting?
Yeah, I think sort of from a career trajectory perspective, I think you always have the opportunity to work at a hospital, potentially at any point in your career. But once you do work at a hospital, I think you end up sort of funneling into a particular department or division or type of role, whether it's I'm going to be the administrator for the Department of Cardiology, or I'm going to work on the procurement supply chain team. I think that can be great as your career progresses, but I think initially that can be a limiting factor. And so I was really drawn to consulting for the simple reason that I knew I'd be working with a number of different hospitals on a number of different problems that hospitals face. And I think it's important to know what the potential barriers and issues are. And if I were to ever in the future work at a hospital, I think I'd have a much keener sense of what different types of hospitals face and how they actually come up with solutions to those, whether it's a workflow efficiency problem or an overutilization of a particular antibiotic or whatever it might be. I think consulting just was a little more attractive at an early career stage from the perspective of getting a lot of different experiences across a lot of different divisions and departments.
One of the neat things it sounds like too is that, if you work in the hospital setting and you kind of maybe stay in a certain division or move up in the division, you become really specialized and you become, say, really good at cardiac services operations or something like that. But it sounds like in consulting, you're often moving between divisions, maybe between rural versus urban hospitals, large academic centers versus community, hospitals, and sounds like maybe perhaps you became more of a generalist and kind of used to many different sorts of scenarios and situations.
Yeah, that's exactly it. And again, I think a little bit of it comes down to like early, mid, and late career. I think early in your career, personally, I think it's better to be a generalist and to just absorb and learn as much as you can. Of course, eventually, in order to progress, you do have to start becoming a little more of a specialist as you go up and as you kind of continue your career trajectory. Whether that's at a hospital or even at a consulting firm, people actually get more specialized as they continue on and tend to focus on very narrow aspects of different types of projects. So I just think for anyone who's sort of early career thinking about CS or even just other general kind of healthcare related fields, I think it is important to try and just understand as much as you can about the way healthcare is delivered, about the inefficiencies with how healthcare is delivered. Depending on which country you live in, you may want to have a better understanding of insurance, the societal and behavioral factors that lead to kind of the way people seek healthcare. And so there's just a lot of different things that I think you can be exposed to as a consultant, but also in just different types of roles.
So I actually, like in medicine, not a lot, but I definitely have some colleagues who either end up going into consulting. So they'll do their medical training and they'll end up at McKinsey or something. And I'm not, maybe they just didn't want to do clinical anymore or whatnot. But I'm curious if you came across a lot of clinicians who were consultants in your roles, and I don't know, is there anything different about them that you notice from just say day-to-day clinical people that you worked with?
Yeah, when I worked at the advisory board, we had a few people. So we had people who were in similar roles to me, who were formerly nurses, and we actually also had like a very specialty role of someone who was quite a established, like late career surgeon. And all of those people had kind of stepped away from patient care into these roles of consulting. And they just brought a completely different and actually invaluable perspective to their clients because they had truly been in their shoes. Like when my colleague who was a nurse was having a conversation, it was received very differently because they truly felt like she empathized with them because she had been there. She had worked the 12-hour shifts and been exhausted and, not had a minute to eat and, understood, yeah, you're overworked. I'm asking you to take on this one more thing. Whereas coming from me, who very much has more of the operational and management background of things, the message is just sometimes received differently. And so, yeah, people who are clinicians and move into that consulting role can be really effective at communicating with others who are still in the clinical role in terms of why, we may want to change a particular workflow or why something costs a lot of money. And I know, especially in Canada, it's pretty almost like taboo to talk about money in healthcare because of everyone having coverage, which is a wonderful thing. But there's this attitude of we don't talk about the money. It's just, we care for everybody. And that can be problematic when it comes to the continuation of actually providing really high quality, good service to the patients. I think I have told Alan this before, but I had a professor at Johns Hopkins who one of his favorite lines was no margin, no mission. And that really resonates with me because if you can actually successfully run your hospital, your clinic, your healthcare practice, I'm not talking about making a huge profit, but run it, as a business that is able to invest back in itself and be successful over time. That's the only way you're actually going to achieve your mission of helping people. And so I think it's the clinicians have a great perspective and, but so do the people in some other roles who come from it as I'm trying to help you achieve what you want, which is to practice good patient care.
So that reminds me of something. So, one of the challenges we have in Seamless, but I think for any company that works with patients, providers, and administration is that we have to create value for all of these stakeholders or else we won't get adoption of our solution, right? So I think one of the things that, we talk about internally is, as much as we want to be incredibly patient-centered with, the Seamless product, we also realize that, well, the customer that pays us is the health system. And so we have to make administrators happy when it comes to things like driving outcomes improvements and cost savings. And then we have to make, frontline providers happy with, whether that's research or QI, and then we make patients happy. And we don't have the luxury of having, one type of user who's also the buyer. I'm curious, now that you've been here at Seamless for several years now, how you think about that challenge, and kind of maybe, for organizations who are thinking about implementing, a digital patient engagement solution, or frankly, any healthcare innovation that touches all these stakeholders, how they need to think about balancing all these, the value proposition, all these stakeholders.
Yeah, I mean, having worked at Seamless and in my past experience, first of all, stakeholder buy-in is huge, because if you don't actually have buy-in from, as you said, people at the executive level, maybe somebody who's a surgeon, and then all of the actual frontline clinical staff and workers who are the ones probably seeing the patients the most, they have extremely different and competing priorities in some ways. But what we kind of have to get across with Seamless is, how does the platform actually impact the one thing that you care about most? And so when we talk about stakeholder buy-in, and I really can't stress this enough, having a good kickoff meeting, for example, for our implementations, one of the key things to highlight and outline from the very beginning is, what are your goals as an organization? And that includes not just the high-level executive goal of, we want to reduce length of stay, because while a nurse may care about that, really what she cares about, or he cares about, is, I'm already overworked. Is this going to actually help decrease my workload, or is this going to add an additional hour to my day every day? And so it's really important to bring everyone together, but then also address what's important to those stakeholders. So exactly as you said, the executives care about, we need to reduce readmissions, but the nurse cares about, actually very specifically, my patients have a lot of wound issues, and my patients have a lot of dehydration issues. And so what I want is for Seamless to proactively be reminding them to drink water and stay hydrated, or allow them to send a wound picture if they're concerned at all. And so it's about those competing priorities, and ensuring we at least say, we hear you when you say this is your main concern, and this is how Seamless is going to help you. So it is a variety of different things, and sometimes it can be challenging. And yeah, sometimes it's researchers or surgeons who are researchers who really want data that they've never had before. And it's really cool that they're going to have this data that they've never had before. But there also has to be the balance of, are we asking this question just because you want to collect this data point? Is there going to be any sort of positive outcome for that particular patient by reporting this survey or this data point back to you? And that's where I think our content and patient education team does a really good job of trying to balance, in the initial build of the programs, the priorities of all of those stakeholders, while, of course, for us, maintaining a patient-centric approach to delivering engagement.
And Meherazade, at this point, you've done a number of different kickoffs and implemented for a number of customers. What's the general reception been on some of these kickoff calls? Have you seen it mixes? Is it real vary, or does the reception vary, or what's it been like?
I would say maybe 65 to 75% of our calls are very straightforward and go very similarly, which is an introduction of the Seamless platform, usually a couple of questions about how will this workflow work, again, addressing some of those, what are the goals for your particular department or organization, and how is Seamless going to help with some of those. And for the most part, I think they're really positive meetings. And we come out of it with a really great understanding, a plan to say, we're going to go through the next 10, 12 weeks and build this really amazing program with your input that's very customized to your patients. I do think we occasionally have some kickoffs that, I don't want to make everything sound rosy. We've definitely had challenging kickoffs. I think one of the challenges is when we've actually had too many people. I just talked about stakeholder engagement and buy-in, and you want people to feel like they have a seat at the table. But occasionally we've had so many people on the call that it actually has completely detracted or derailed the conversation in a direction that was never the intention of bringing in Seamless. And so I do remember a particularly challenging kickoff meeting where I believe we had about 80 people, and it was a WebEx. And so this was not a productive meeting once, it was, and the chief of cardiac surgery there, he was the department chair, and he kind of went off on a tangent about things that weren't actually necessarily even really about Seamless. It was about the hospital having the resources to potentially support some of the initiatives that we were trying to bring forward. And so it was definitely a rocky start. People didn't always have the opportunity to get all their questions answered. The meeting ended up running way over time. And so these are things we learn from. In the future, I think we've always tried to ensure kickoff meetings include representation from different stakeholders, but we don't necessarily have 80 people on the line. That's not best practice. We'd like to have maybe 10, 12, 15 of the key players on the line, depending on how big somebody's clinical department or team is. And so, they're not all the same. While we do have a general structure that we go through during each of these, they can certainly take off in different directions. And sometimes, even on sort of a positive end of the spectrum, we might actually get a little bit sidetracked, but lead to a really good additional conversation. Like, we do a lot of work with bariatrics programs, and they're kind of a unique population because for them, it's not, you come in, you see the doctor, and you get scheduled for surgery within, 4 weeks, 5 weeks, 2 weeks. It's very much, you've got a, at minimum, 3 months, very often closer to 6 months process to really even get to the point where you're eligible for surgery. And so there's a lot of different unique needs, and having worked with many of our bariatrics programs, especially our early ones, we've kind of really evolved how those programs work and function and kind of tailor to a completely different need for their population, which comes out of often the questions they ask on the kickoff. Well, could you remind my patient about their dietitian appointment every month, because they need to do that every month in order to become eligible. So it's the little things like that where the kickoff can kind of go in a different direction than we might have originally anticipated, sometimes positively, occasionally negatively, but I think they're all learning experiences.
Meherazade, can I ask you? So sometimes, like, I learn about organizations where, they've tried to, let's say, develop something like Seamless fully on their own, and they end up implementing their own digital patient engagement platform, and they get like 20% patient adoption, and then they end up having the perspective that, oh, patients won't use technology like this, so let's not try to venture down that path. But obviously here at Seamless, we're regularly seeing 80, 90% patient adoption, engagement, things like that. And yeah, I do think our technology platform is industry leading and better than a lot of the stuff out there, and certainly better than something that was developed one time in house. But one of the things I think we've learned is that the services components, the work that our CS team does and customer success or patient education team does in bringing best practices to making not only the programs engaging, but also, like your team there, is at showing our clinical partners, here's how to get a patient to adopt Seamless, here's how to educate the family. And these are important playbooks that help our partners be successful. I'd love to get your take on the importance of the services component and the best practices component to make sure that patients actually engage and adopt.
Yeah, and we of course think of Seamless as sort of a software as a service platform, and part of that service component really does also come down to the people. And I think a lot of formerly failed technologies where they failed was really that people component, because you could do a fantastic implementation even, but once you say, okay, well, the product's there, you can use it, and you leave them alone, there's not a lot driving the use, the engagement, and even just the constant bringing it back to the front of their minds. Whereas with our CS team here, what we're really striving to do is, of course, ensure our patients and customers are so satisfied. But really, what does that come down to? It comes down to, we check in with them probably once every other week or maybe once a month, depending on the needs of the customer. What we're really driving in each of those interactions is building that relationship where Seamless and the entire idea of patient engagement just becomes a part of the care they deliver to their patients. And to drive that, as you said, we've got some industry leading numbers on engagement, which, yes, we can credit a lot of that to the way the platform is built. But I think I also want to credit our CS team here with the way they ensure that our customers are having all of their needs met, whether it's, oh, we had a slight hiccup with enrolling this patient today, that got resolved right away. Or, COVID happened and our workflows are upside down. So yeah, we had to completely redesign how some of our hospitals are currently enrolling patients. Maybe it's over the phone, maybe it's during a telehealth visit that they're having, because they're not even seeing the patient until they get to the hospital the day of the surgery, really, sometimes. And so for CS, there's a lot of the everyday pieces that can sometimes get forgotten, that human touch. And then there's also, of course, reminding them of those goals we said right at the beginning in the kickoff, right? So while everyone has the goals in the back of their head, when you keep bringing back, if we keep pushing Seamless and we keep having great patient engagement, we're going to have more patients actually do their health checks, their surveys, and they're going to tell you, if they're having a problem, or if the patient, does have a problem, the patient is getting told, please call this specific number because if you're a colorectal patient and you have an ostomy issue, this is the number for your ostomy nurse. Please call them. And so that's where it starts impacting those outcomes. And once we kind of get them in that cycle of realizing, okay, if we can continue as providers to make patients realize that Seamless is just a part of their care package here at our institution, we are seeing the outcomes, we're seeing the results. And then that kind of drives to some of the conversations we have, as well as maybe more high-level quarterly business reviews that we sometimes conduct to bring all those outcomes back, to bring all those stakeholders back, because on a normal weekly basis, daily basis, those stakeholders don't interact with each other and they don't kind of come together to talk about Seamless. So it's an opportunity for us to actually bring everyone together and highlight the success, the great outcomes, the engagement, whatever that might be. And once we can get that as just a normal, it's just the normalizing patient engagement and technology as part of patient care, we have really successful partnerships. And we have hospitals who do incredible data analyses to actually really highlight that themselves and see the difference between their patients who use Seamless and their patients who don't use Seamless, whether it's a reduction in readmissions, like a significant 30-day reduction, or maybe it's actual cost of the surgical episode. We've had, of course, a great number of case studies. I know Alan's got them up on our website. And so, for those who are interested in some of the great outcomes, they can certainly head there to look at them. But I think that's really what our CS team is about. It's about driving that relationship and that attitude till all of our customers really feel like, yeah, Seamless is just a normal part of care, and it really helps drive results. And so one of the most frequent questions we get is, well, my patient's 80 years old. Are they really going to use Seamless? The answer is yes, they are. You'll, first of all, be surprised, and let's not be sort of technology ageist about what people can and can't do. But we do have so many things built in to support people at different levels of age, technology, sort of comfort, just general adaptness with online programs, whether it's our health literacy aspect or just the easy, simple to follow, or even just, you may not have a smartphone, you may have a computer, or we're still giving you the important text message reminders of what to do before surgery. So patients in different situations can still really benefit from what seems like something that was only, to a lot of people in their minds, built for, like the 40-year-old patient who's really tech savvy. So
you touched a bit on kind of how we can help improve adoption of digital patient engagement platforms. So you mentioned that within the platform, making it accessible by making it available on not just smartphones and tablets but desktop. You mentioned in the platform the interface being accessible, like the level of the literacy level, the fact that it meets guidelines for screen reader accessibility, etc. What about best practice you found really helpful for driving adoption from a workflow point of view? So I know one thing that you always tend to emphasize to our partners is making Seamless the standard of care, making it an opt-out, not an opt-in. And anything else that you found to be helpful in just getting better adoption from patients?
Yeah, there's a few things. I would say one of the primary is really, at the end of the day, patients take their surgeon or doctor's word as gospel. If a physician directly says to me as a patient, I want you to use Seamless, it will remind you of what to do and tell you who to call if you're having a certain problem when you report your survey, there is nothing that gets a patient as excited. We find time and time again, we have data to back this up, that our clinical teams who take 2 minutes to talk to the patient about Seamless and sign them up and kind of walk them through a little bit of what it is, have a significantly higher rate of adoption than the teams who simply hand them a brochure or ask them to self-sign themselves up with little to no context of what the program is. So I think first and foremost, for providers to drive additional engagement or adoption, they need to take the 2 minutes. And I think our leading and most successful customers all do this extremely well. Some of them have done their own unique things. Some of them have created their own videos that they might show a patient on an iPad. And we realize not every hospital has that kind of resource, But even, like I said, the one sentence from the surgeon makes a world of difference. Something else to, beyond just the initial engagement and activation, I think something that drives post-discharge activation, because we understand that even when patients get on the program, they're engaged with it, they like it, there are reasons why they may start dropping off or disengaging after surgery. Patients are in pain, they may be groggy from their medications. Seamless is not the first thing they want to do when they wake up. But providers can actually do some very simple things that make Seamless, again, something that comes to the patient's mind, which is providers could actually prescribe Seamless to the patient to use at home as part of their discharge paperwork. So right on their discharge sheet, along with all their medications and their instructions, one of the things could be use Seamless at home. It's as simple as adding a line to the discharge sheet for every patient. Or we can have, very often, especially in the post-surgical world, patients have a quick phone call from the hospital, maybe a week in, 7 days after they go home. And again, they have a standard list of questions that they typically ask the patient. I've had a few of my customers add a question to the bottom of that sheet that says, have you done a check-in on Seamless since you've gone home? And so these are ways, quick, easy ways to kind of have these little wins, and for providers from their side to continue engaging patients throughout the journey.
Can I ask, so I want to get your take on maybe some of the different ways that our clinical partners use Seamless to achieve, certain results. So for example, for the customers that you work with who've seen the best results on reducing readmissions or ED visits, how are they using Seamless better or more differently than other partners?
Yeah, so as you said, Seamless does have a number of different functionalities, and not every customer uses every single piece of functionality, but the ones who are most engaged and see some of our best results, let's focus on readmissions, for example. It's about using our clinical alert system. And this, for those who don't know, for the most part, when a patient fills out their survey on Seamless, they'll get a specific set of recommendations. If you have a fever over 12 hours, you should be calling this number. If you are concerned about your wound, you can send a wound photo back. Now, things like that, when our clinical team then decides they want to get alerts, they actually proactively get that message back. Hey, you've got a patient who submitted a wound photo. Why don't you take a look at it? And so I want to emphasize, we don't send alerts for every single thing that a patient reports. We're not talking about patients who are reporting minor constipation for a day or two. That's not what alerts are meant for. They're really a phenomenal way to know when a patient is really struggling with the most important pieces of their recovery at home, depending on the type of surgery they had. So a drain fell out or something serious to that effect. The idea is not to overwhelm the clinical team with notifications, but by knowing what are the 5 most important things for our patient population, whether it's dehydration or wound issues or fevers, if we can address those and set up alerts for those, you're now catching that much, much earlier. And so the patient is reporting it. The patient is still being told, patient, go ahead and call this number because you are reporting these issues, but your clinical team is now also aware. And they might even get the patient before the patient manages to call them. And that's where it can be really impactful. We've seen that time and time again with readmissions in particular. If you can, of course, catch a patient on day 10 who's having drainage issues or wound issues, you can bring that patient back into clinic. They're not waiting to the point where they get so bad that they have to go to an ER, possibly get admitted again and stay overnight at the hospital. And so these are the things that really make a difference between, I think, our highest performing hospitals and those who still use a lot of functionality and still get good results, but kind of this brings them over the edge. And so from a workflow perspective, it's not actually that different for a nurse, as if I, as a patient who didn't have Seamless, just picked up the phone and called my nurse team and said, maybe I didn't even get the nurse, I got an answering machine, and I left a message to say, hi, it's Meherazade. I had my surgery 7 days ago. I'm really concerned about my wound. In that situation, the nurse is going to call the patient back, say, tell me more. Unfortunately, they're not going to have a wound photo to look at. They're probably going to say, why don't you come in? We'll take a look. Whereas with Seamless, I, as the patient, report it, put my photo into the program. Maybe I call the nurse, or maybe she calls me if she sees the alert first and goes, oh, I looked at your wound. There is some redness, but that's actually normal after surgery. Keep an eye on it, and if it gets worse, send us another photo. And so it's not actually changing the fact that the nurse would have that interaction with the patient. It's just kind of preempting things and providing more information to the care team.
Even then, I do find that, there are some clinical teams who just say, I don't want any alerts. I don't want to monitor any patient. I don't want to set an expectation that I'm looking at anything. And then there's others who probably say, hey, Meherazade, please turn the alerts on. I want the dashboards. I want to know everything that my patient's doing. I want to catch that issue earlier. And I'm just curious, do you find that there's just this bifurcation in clinical teams where some just want to be super involved and engaged? And maybe it's because they have more time or have a different perspective. There are others who maybe don't have the time or resource and they just don't. Do you feel like there's just a bifurcation that you just run into at the start of an implementation? Or is it something that changes over time, depending on the team that you work with?
I think it can change over time. So while, yes, when we start, there's generally a sense of we're a team who wants to do alerts, or we're a team who, is pretty unsure about the alerts. Maybe we will start without the alerts. I think people do change their minds about it as time goes on. Last week, we had a customer actually who changed their minds. They've only been going for a couple of months and have realized, I actually would love to know proactively if a patient reports a heart rate, over 100 or whatever it is. And so I think that's part of the CS team's role here, really, which is having those interactions, building that relationship with the team where they realize, Seamless is here to support us. Seamless is here to try and help us do the best we can for our patients. And deep down, I think all clinical teams care a lot about, the outcomes for their patients. It's not that in a perfect world, I think all of them would like the alert. I think a lot of it comes down to resourcing and them saying, well, we just maybe don't have the capability, or, we are an extremely high volume surgical line. And so we have 1,000 patients coming through every year versus a team who may honestly have a similar number of nurses, but have a significantly lower volume. I think some of it just comes down to volume and resourcing. And so over time, as they realize, okay, maybe we could handle it. And maybe we introduce it with just 1 or 2 alerts. Maybe it's just the wound photo. Only if a patient is concerned, we get the wound photo. Then, okay, that's been really manageable. What about adding in like 3 or 4 more alerts? We always actually discourage our customers from turning on every alert at the beginning. It can be a lot. We do have one. We do have one customer who pretty much gets an alert for every single thing a patient reports back, but that team manages it. So that's great for their patients. But I think there's a good balance in sort of having somewhere between, I would say, 8 to 15 of, again, do you know what are the 5 or 10 most critical things that are issues for your patient population? And that's typically pretty standard across different surgical lines and different programs.
And Meherazade,
sure, go ahead, Alan.
do you have any feedback from our customers in terms of how long it actually takes if they are monitoring patients? So I know you mentioned, nurses are typically skeptical if it's going to be, this is adding, another hour, 2 hours, 3 hours to my day. Do you have any feedback from our customers in terms of how long they're actually spending on the system if they do choose to get alerts?
Yeah, I think anecdotally, and even in sort of some provider experience surveys that we've conducted, most people, even the ones who are turning on alerts and getting notifications if a patient has an issue, I would say they're spending anywhere between 30 minutes and 2 hours a week on Seamless. So this is not, per day, a significant amount, depending on whose team you're on, how many other nurses there might be, because we can send an alert back to, let's say, a gyn-onc team. They may have 5 nurses, and so one of them is going to pick up that alert on a Monday, but somebody else may pick up the alert on a Tuesday. And so between enrolling patients as well as potentially monitoring them, the vast majority of our clinical teams really spend between, like I said, about 30 minutes to 2 hours on Seamless in any given week. And that's, I think, reasonable. And it, that 30 minutes to 2 hours, someone may say, well, I still don't have 2 extra hours in the week. Where Seamless is compensating for that is with the reduction we've seen in phone calls and visits back. So for those low-level things like I've been constipated for 1 to 2 days, patients aren't told to call their team. Patients are told, that's kind of normal. You're on some painkillers right now. Why don't you try these tips? Have you taken a laxative? And so we're actually starting to avoid and reduce the number of unnecessary phone calls, as we term them, back to the clinical team. And so they're actually getting some of that time back in terms of when they enroll a patient or monitor a patient.
But what about for more and more of our customers, they're choosing to integrate Seamless with their EHRs such as Epic or Cerner. From a day-to-day clinician point of view, what are the most important integrated workflows that we've done that providers would appreciate the most?
Yeah, so for context, for our sort of podcast listeners here, when we're talking about integrations, we're really talking about having the entire Seamless dashboard and enrollment and roster, basically everything Seamless related being right in your EMR, whether you use Epic or Cerner or whatever it is. And so I think one of the big pros of being integrated from the beginning are it's a really smooth user experience from the provider side. There's no logins, there's no passwords. They're basically going into Epic and, I'm seeing a patient right now in clinic and I want to enroll that patient in Seamless. I just literally click the Seamless button within their chart, pre-populates all their data. I add in, I want to set them up for having surgery 3 weeks from now and get them on that care plan, and I'm done. Takes less than 30 seconds. I would say what's really great is, again, just that seamless experience for the provider of having it all be integrated. I think if we talk about sort of the reverse of that, and maybe a little bit of the con of that, it can take a little while to configure. It totally depends on the IT department at each hospital. We've really had someone configure nearly an entire integration within a day, and then we've had others that have taken a little bit longer if they've never worked with the kind of integrations we do before. But for those who just really want to get started with Seamless really quick, we do have, of course, our standalone version that we can get up and running very, very quickly. And sometimes it's that the IT department or CIO or team at the hospital just really doesn't want to invest in a full integration for one department, especially if we first come into a hospital working with just orthopedics, for example. And then, over time, if we grow from orthopedics to now 5 departments and now the entire department of surgery, we're far more likely to get the yes to go ahead and do a full integration at that point. But I personally do think it's wonderful to do the integration from the beginning. There's obviously this entire provider side I talked about. There is also the patient side because we're able to integrate with the patient-facing MyChart tools and other tools that are sort of patient portal for these hospitals. And so patients could also access Seamless directly from there rather than, again, as a standalone and going to Seamless separately and logging in from there. So I think there's really a lot of upside to integration from the beginning. I highly encourage it, but I can understand why occasionally we'll just say, let's just go ahead, start with the standalone. Maybe we'll move into the integration. We've done that a few times, actually. Probably that's more common, starting with the standalone and then moving to the integration. But I would say it saves everyone a lot of time and effort in the long run by just doing it at the beginning.
Could you maybe talk also a bit about, with COVID-19 having happened, I know that you and the CS team have been working with a lot of our customers on, maybe some different unique workflows or screening tools in light of COVID-19. Is there one in particular that stands out to you that was particularly interesting or different?
I think we did a lot of different work during COVID, and I'll touch on 2 to 3 different areas. One was from our provider side and their workflows. We definitely had to be a little creative. There were a lot of concerns about how am I going to explain Seamless, to a patient on the phone. And you can talk to them about it. Here's a script for you. Here's a link to a Seamless video if you want to share that with them. And also, here's their brochure. Make sure you still email it to them, even if you're not able to physically hand it to them. So it's little things like that on the workflow side. But I would say the bigger impact I think Seamless has really been about patient education, reassurance. We added so much COVID information to our platform, to our programs as soon as things started, even some great educational videos and other things, as well as screenings, for the patients who are scheduled for surgeries that were still happening. We had a lot of our hospitals say, well, we need to know if these patients are doing well or if they're potentially showing any signs or symptoms 2 weeks out, 3 weeks out, because that's going to cancel or delay their surgery. Are they even, mentally and emotionally ready to have surgery? There were patients who were scheduled for surgery, but were perhaps rightly terrified to go into a hospital at certain points, depending on where they lived in the country. And so a lot of the work that was done on the patient side was providing more information and having them have that conduit of being able to tell their care team how they're doing prior to surgery. So I think that really helps, and helps the providers know, should I even schedule this patient, or should we just schedule somebody else who's ready for surgery? I would say the last thing that's a little outside the wheelhouse of what, we normally think of as Seamless being very patient-centric and provider-centric, but for our providers and, whether they're a hospital or even maybe a home care agency, we also started doing a lot of screenings for their employees to say, are you safe to come into work today? And I think that's equally as important in terms of keeping everybody safe and screened.
So obviously, with COVID-19, we've seen a big increase in adoption of virtual care in general, not just things like Seamless, but telemedicine, video visits, et cetera, et cetera. I'm curious to get your take on, as things have started to reopen, as providers or and patients both are going to be frankly in the hospital or the clinic more than maybe they were the last few months. How do you think that's going to affect the increased adoption that we've seen of virtual care and digital? Like, do you think it's just going to be sustained, the increase that we've seen? Do you think that folks who, let's say, tried video visits are going to go back to maybe not quite where they were before, but maybe not quite where they are now in terms of how much they use it? Like, what's your take on how things are going to shape out in the next maybe 12 months or so?
Yes, obviously personal opinion here, but I think this is definitely push things along in terms of, are we going to see sort of a retraction back as things open up? I think we'll see a little bit of a retraction back. There are just people who like doing things in person, seeing things in person. And even from a medical standpoint, there's some things you just have to look at and feel to know. But I think for a lot of the lower level care or just follow-up visit where everything might be fine, honestly, it's just always been standard to see your doctor a week later. I mean, do you really need to go all the way in? If you're fine, you could have that be a video visit. And I think a lot of hospitals are looking at that and saying, we want to continue this. It's working. Yeah, it was a scramble to get it working during COVID, but now that we're here, now that we're stable, and now that, everyone also has just had an increased level of comfort. Within our company, we always turn on our video cameras. Now, when we have a meeting and with our clients, when I get on a client meeting, even just from March through, I guess we're at the end of July, the evolution has been very speedy of how comfortable people have gotten with just that virtual face-to-face interaction rather than the in-person interaction. Turning on their cameras, forgetting about their hair, their makeup, their clothes. Most of our providers are in their scrubs and their masks and very, very comfortable now getting on a Zoom call or WebEx or whatever it is we're using. And so I think some of that is there to stay. I think a lot of patients too are very much of the opinion that I don't have to go in, I don't want to. Why should I? And what we forget is a lot of the hospitals we work with a variety, but we work with a lot of large academic medical centers. These are, renowned tertiary care centers. So they're attracting patients from a much wider sort of catchment area than just the immediate area that the hospital is in. If we think about one of our wonderful partners down at UAB in Alabama, I mean, they're in Birmingham, but they attract patients from across the entire state, as well as patients from Mississippi and other, even parts of Florida and Georgia coming into there, and Tennessee. And so, if I'm a patient who lives 300 miles away from Birmingham and I have a follow-up visit with my doctor, but everything has been absolutely fine after my surgery, I don't need to go in. I don't need to drive that amount just to expose myself to potentially infection coming back to the hospital or back to a clinic. And just, it's nicer for the patient to not have to make that journey. And so I do think some of it will stay. I think what has to go hand in hand with that staying is actually around reimbursement and how people get paid for those visits, because, COVID kind of definitely accelerated the use of these technologies, but insurance and sort of payment has not caught up to actually reimbursing providers fairly for the amount of work or the time spent on those calls, especially as those things start to replace what used to be in-person billable visits at a much higher rate. And so I think in order for a lot of the digital sort of advancement to stay, there will have to be additional improvements in reimbursement to really have it be sticky.
Actually, so we're on the vendor end of things, but one thing I think about is, and I think we're lucky because I think we're mostly a software company, so we can do a lot of things remotely. But I think about some of the vendors are, let's say, medical device companies, where their reps or their team members are typically on site in the OR, right? They have to have face-to-face meetings, and obviously, I think at least temporarily, hospitals shut down on visitors and vendors coming in on site. Over the next 12 months, as things start to really reopen again, where do you think that policy is going to be in terms of vendors coming in? Do you think it's going to go back to normal, but maybe you have to, I don't know, wear a mask indoors if you're a vendor or something else? Like how do you think that's going to turn out?
Yeah, I think, funnily enough, we, as we said, we're a software-based vendor. We can do a lot of things kind of remotely, but just because we're tracked as a vendor in our hospital systems, I used to get vendor notifications from one of our hospitals that basically every couple of weeks, it would be their latest policy on like whether vendors were allowed in. Initially, of course, it was all shut down, and then it was like, you're allowed, but you're allowed in the administrative building. You're not allowed anywhere in the hospital. Must have a mask on, all of the other precautions. And, as time has gone on and things are a little more in control in, these areas, it certainly opened up more. There's still, of course, there's masks and sanitizer. I'm not sure they're still allowed in, obviously, any patient care areas. And so I think it'll be interesting. I think there is something to be said for just that human face-to-face, even as we get more comfortable, and we certainly could do a lot more of our business virtually. I do think there is some value in still maintaining some of that face-to-face relationship. For us, and for some others, it's more necessary to really do that to keep your business going. So I'm not sure. I think people will be back. I think it might just take a while, and I think it'll also depend on the severity of surges and resurgence. Because at the end of the day, I think the one thing people have realized is COVID isn't going away. At the beginning, everyone was kind of like, oh, it's a 2-week thing, it's a 3-week thing, we have to stay home, and then everything will be fine. And that's not really the situation as it's evolved. And right now it's COVID. Frankly, there might be other things in the future that are similar in circumstance and cause people to have to figure out ways to work more virtually. But there are going to be periods in between when things are a little more normal, where I think there's still going to be a fair amount of face-to-face. I think it also depends on, I think, where you are and where your clients are. I mean, for us as a Canadian-based Toronto company, with a large number of clients in the US, of course, right now the border's closed. Eventually, we know at some point the border will be open, and will we be traveling back and forth, then there's still going to be potentially quarantine happening at either end when you enter there and when you come back. And so what does that look like if we actually did need to go on site for our clients? I think that's something that's going to develop over time. It may look like we're going to pick a month, and in that month, maybe have to quarantine initially, and then, hit 5 of our hospitals at the same time, so that, it's one trip, and then come back and quarantine again here in Toronto. So we'll see. We don't know.
Make a road trip. I like that idea. So Meherazade, just looking at the time, I do want to wrap things up because I don't want to hold you all day, but we do have this new thing that we're going with all of our guests on the show, where we have a fast 5 kind of lightning round of different questions. And so I'll read a couple questions to you, and you can answer it pretty much as quickly as you can, but you don't need to think too hard into it. First question that we have is, what's your favorite book or book that you've gifted the most?
Gifted the most. I mean, I think the book I recommend the most and probably read the most is anything from the Jeeves and Wooster series by P.G. Wodehouse. I just like to keep my reading light and fun. So yeah, probably that.
I've never heard of that one.
Neither have I.
It's like a very British humor between sort of a little bit of an aristocratic young man and his butler. So
what's it called again?
It's a series of books. The author is P.G. Wodehouse, but the characters are Jeeves and Wooster. So. Okay,
Alan, we'll need to make sure to put this in the show notes.
Definitely. So this is a fun fact about Meherazade that we haven't talked about yet, and this is what's inspired this next question. But Meherazade has actually traveled all over the place, and I know one of her favorite things to do is to visit restaurants at all, like the most famous restaurants that you can get to. in every city that you visit. So I'm wondering, what is your favorite restaurant of all time, or what would your favorite restaurant be if you had to eat dinner tonight somewhere in the world?
Oh, okay. Boy, this is like hard for somebody who goes to a lot of restaurants and loves sort of trying the different things. Okay, I'll kind of break it down into, okay, tonight, honestly, if I had to eat dinner in Toronto, I'd probably just go to Seven Lives Tacos in Kensington Market, which is a hole in the wall. And yes, I like going to kind of the renowned restaurants, but that doesn't always mean like Michelin star. If I were home in Mumbai, I probably would go on the fancier end, and I'd probably go to one of the restaurants at the Taj Hotel there. All of them are great. And then, man, just anywhere in the world.
What about in Baltimore? Because you spent a lot of time in Baltimore with Hopkins and such.
Oh, Baltimore actually has some great restaurants. I will say, I'm not sure I would pick one. I'll actually say they have a great cocktail scene, like amazing little bars with craft cocktails. There's a number of them sort of in the, not like right in the touristy waterfront area, but you go kind of a few blocks over to the right, and that area is like very young, hip, and has a lot of things going on. But I think Josh had something else he wanted to ask me.
Yeah, so Meherazade, you've been in many hospitals before, so I think this is a very important question. Which hospital that you've been to has the best cafeteria?
That's a toughie, because see, some hospitals have really great variety, and so it's just kind of like, well, I could get sushi or like fried chicken or a salad. But some hospitals just have like really good food, actually. So maybe we'll go with UAB. Actually has a really good variety of food. I'll say that in their cafeteria, though I am partial actually to getting the sushi. And then I would say the other one that has actually always been fantastic is UC Davis. Their cafeteria is very good, a lot of options, a lot of like that healthy California kind of vibe. So those are definitely two of the better ones.
Yeah, and I'll say, I know like between Canada and the US, there's a huge debate about, the different healthcare systems and payment models and administration. But definitely, I think Canada can learn a lot from many of the American hospital cafeterias. They do that in many ways much better than we do.
Yeah, and what's funny is while I do have some Canadian customers, I'm not sure I've ever eaten in one of their cafeterias, and frankly, from everything I've heard from everyone else, I'm not sure I want to. So
it's mostly Tim Hortons, maybe a Subway. That's about it. Those are your options. All right, just last two questions real quick. What advice would you give to someone who wants to do what you do?
Let's do what I do.
Talking about squash, right?
Yeah,
I'm talking about squash.
Learn squash early. No, I think from a career perspective, it's be a sponge. Like, just allow yourself to experience different learning opportunities. Even if you're someone who's, let's say you're an intern or a co-op student, even our co-op students who come work for us at Seamless, even when I have a co-op who's working sort of in the customer success department, I always encourage them to actually sit in on Alan's meetings and learn more about sales and marketing and the kinds of things he does. And think in different ways that just builds both hard and soft skills. And so it's just be a sponge, just kind of be open and soak up a lot of the things that are available to you.
Yep. The last question that we have, it's a COVID related question, but during this pandemic, have you picked up any new skills or activities, hobbies, anything new that you've been doing?
New skills, hobbies. Well, I've been running a lot more because I can't go play squash in a closed box with somebody else sweating on each other. But running is a little more of a return to it. Fun fact, my dad was an Olympic athlete for India, so track is kind of in my blood. Wow. I'm very, very bad at long distances, but I've been trying during COVID. And then I would say the other thing I've probably been doing at home is just like a little bit of origami. It's fun, it's calming. So
excellent.
What's your favorite thing to make with origami?
I mean, it's pretty basic, but I like cranes. They're fun. Honestly, like there's a lot of fun little things. You could do the little frogs that can jump.
Yeah.
You can also do just like flowers and other things. So yeah.
Do you have any with you?
Not in like any of the immediate vicinity right here. Yeah, nothing
Really
really.
not that big of a hobby.
That's good. I just imagine your room is littered with all these cranes everywhere.
No, I usually just like do them and like give them to a friend or like eventually throw them away. I'm pretty minimalist when it comes to my apartment. I don't like a lot of stuff in there.
Yeah, I'm about the same. Well, awesome. I'm looking at the time. We're over an hour now, so we should probably cut it here. But Meherazade, do want to thank you, sir, so much for being on the show today with us. You've blessed our audience with all your wisdom from the customer success sphere. And I guess I should ask, if people want to reach out to you and contact you, where should I direct them? Where should you direct them? Where can they reach you?
I don't know.
I feel like I'm having a stroke every time I ask a question. Where can the audience reach you, Meherazade?
Yeah, I mean, if people have specific questions about CS or Seamless, yeah, I mean, reach out to me on LinkedIn. Always happy to kind of message people back. So
amazing, and we'll post Meherazade's LinkedIn for the world to see on the show notes.
I'm pretty sure the world can see it anyway, but Alan will boost it along.
Exactly. Well, great, Meherazade. Thank you so much for joining.
Yeah, thanks for having me. This was fun. See you guys later.
All right, see you, Meherazade.
Bye.